What happens when the government steps into the exam room and overrides the medical care for youth? Unfortunately, that is not a hypothetical conversation or question anymore. It is happening, folks, right now, and it deserves our attention. We are at a critical crossroads. Federal policy is reshaping private health care decisions, especially for vulnerable youth. Hello, I'm Dr. Rhonda Johnson, and today is Sunday, April 27th, 2025. So in January, a new executive order was signed, followed by a detailed memo from the U.S. Attorney General. This order declares that the federal government will no longer support or fund gender-affirming care for minors. That includes puberty blockers, hormone therapy, and gender-related surgeries for anyone under the age of 19. Now, in many states, there are existing age requirements of 18 years and older for gender-affirming surgery. Now, these changes will have a significant impact on medical care for youth, such as puberty blockers and youth receiving hormonal therapy. Now, the official documents use emotionally charged terms like genital mutilation and junk science to describe treatments that major medical organizations have recognized as medically appropriate in certain cases. So here's what the new policy does. Federal programs like Medicaid and TRICARE will no longer cover gender-affirming care for youth. Hospitals and doctors and researchers could lose funding or even face criminal prosecution for providing this care. The Department of Justice is encouraging lawsuits against providers, including retroactive cases, and a new federal state task force is being built to enforce these restrictions across the country. On Friday, the CMS administrator publicly stated that Medicaid dollars are not to be used for what they call procedures that cause irreversible harm, including sterilization. Folks, this is bigger than politics. It's about who makes medical decisions for young people, their families and their healthcare providers, their doctors, or politicians and prosecutors. So what can we do? Well, we can stay informed. We can speak up because every voice matters. And we can protect your rights. Please track what's happening in your state and how these federal actions could impact local health care access. I suspect it is. So is this the direction we want to take, folks? Should medical professionals be criminalized for providing evidence-based standard of care that their patients have requested? What about the youth who have started the medical care process? What happens to them? And then what group is next? That's my message today. Take care and be well.